an educational session for the healthcare field. We have the objective of this presentation is to educate our clients and prospects on what products that we see are most important in today's thriving practices, and what are those metrics behind those decisions. So at Comtech, we work with some of the country's largest healthcare providers, and we're going to be sharing with you some of the common issues and common goals. The communication system is specifically tailored for the healthcare environment, and it's going to give you the tools that aren't offered in traditional phone systems. We call it the iConnect RX Voice over IP platform, and we say this can give your company, your organization, the prescription for growth. Slide down here. So today's presentation will be approximately 1/2 hour. We're going to provide an overview about common challenges, applications, an overview, and then finally a live demonstration. During this demonstration, it's always important to ask yourself 2 questions. 1, could applying these products and services save my practice money through productivity and time? And 2, is there an efficiency that we could find that could benefit the manner in which we engage our providers, employees, and our patients? So it's never been more competitive. Patients have choices, time's ever more valuable, and providing the best services at a cost-effective manner is top of mind for most practice leaders. There's a lot of consideration going on, so maximizing investment through the economies of scale and technology is a great way to improve satisfaction and patient retention. Surveying hundreds of practice leaders and comparing the successes of the overachievers, we've seen the following 7 challenges that affected profitability and impacted their goals. Overstaffing to make up for bursts of calling. Satisfaction is top of mind. Improving on redundant processes. Faster inter-office communication and easier inter-office communication. Getting patient feedback. Compliance and staying top of mind with security. And an umbrella of saving money over the current spend. Today's desktop flexibility audio is really 3 levels deep. We use our desk phone, PC phones, cell phones. They're all ubiquitous forms of communicating in today's market. Users do not want a different experience based on which devices they choose to call from. So having a platform that integrates all forms of communication is important in today's market. It's even deeper than that. In today's competitive business environment, we communicate well beyond handsets. It's internal chat, faxing, web chat, email, social media, collaboration tools, and more. There are so many ways that people can communicate, so efficiently managing these products through one easy-to-use platform can make communication easier throughout any organization and more productive. These tools can be backed with an easy-to-use recording for historical data and record keeping. Adding new users does not have to be difficult. You can integrate into corporate directories with simple-to-use interfaces, allowing users to self-provision, which in turn frees up company resources and eliminates outside vendor costs. You will see how visual tools such as Presence gives each user a detailed look at the persons within the organization, making communication easier and streamlined. There's global tools like advanced meeting and conferencing services. They eliminate third-party expenses you may have had and incorporating a service that you may never had as a tool. There's advanced call center functionality, allowing the system to be customized to handle patients and interact with EMR systems. This is all balanced out with reporting that can be customized and automated to easily satisfy any office requirement. Result is the technology is a tool for productivity and efficiency. The iConnect RX product is built to improve communications through practical, useful tools, cost savings through streamlined applications, and maximizing headcount with useful tools and dashboards. All in all, this results with patient retention through efficiency and productivity. Technology changes fast, and a healthcare's practice ability to keep up with this change efficiently with the market is a competitive edge that most of our successful practices identify as one of their major differentiators. It's recommended to build this path with a partner that understands your needs, and at Comtech, we call this providing our clients with solutions at the speed of technology. So before we jump into a live demonstration, the iConnect RX platform and its enhanced unified communication functionality, I want to talk a little bit about some of the features that are not in the demo, but are a standard offering of the iConnect RX platform and that are specific to healthcare needs. One, patient appointment reminders is a built-in application. After-hours physician notification, electronic medical records and EHR software integration. You can network remote offices with a single sign-on. There's multilingual built-in support across all applications. There's patient queuing up with automatic callback, electronic prescription refills with automatic notification, and it's all backed up with HIPAA-compliant features like IP faxing. These are some of the features that as we dive deeper into a one-on-one, you may want to ask a little bit more about. So now let's jump into a live demonstration. The first thing I'm going to show you is a desktop application, right? This is for a user environment, making communication within an office simpler. A traditional environment starts off with somebody sitting at their phone and their typical complaint is I don't have enough information, or clients are asking for bigger phones with more buttons. A newer model is to provide instantaneous information through a desktop user interface. So phones can actually be simple and the data is now a PC based. So here's an application that any user could sit down and have at their desktop. So the first thing I do when I log in is in the morning is I'm going to go to my settings here and I have a presence. So two sides of this. I have an active role and I have a role selection. So my active role is important for companies that you can change roles based on a user preference. So for instance, I could be Mike Bertoli of Comtech Systems, but I can also log in as Gage Properties. So in an organization that may have one or two or multiple divisions within their company, each user can select their active role with a click of a mouse. We also advocate, especially in healthcare, establishing call centers with queues. Queues, if you're not familiar with this, is a way that the system can automatically manage the call flow based on the type of call that's entering your practice. So for instance, most people are familiar with an automated attendant. I might say, press 1 to schedule an appointment. Well, by pressing 1, you have the choice. Do you send it to a person? Do you send it to a group of people? Or do I want to send it to a queue? Queuing allows a system to be automated. By automating it, it allows individuals the ability to log in through what we're going to call role selections. It provides management the ability to see what's going on, which we're going to show you as dashboards. And then it allows executive reporting to see how your organization performed. So you may have people at a front desk and you establish all the queues within your organization and you can determine who logs into what queue. So I may log in the morning and this could say new patient login, or this might say doctor's line, and that becomes the queues that I'm associated with. I'm going to move over to here to the left. You have easy to use tools now. I have contacts. In an organization that has many users, you may say, I don't remember people's extensions. In today's world, you have the ability of communicating through various ways. I can call their cell phone. I can send them an email. I can chat with them. So these are really useful tools for saving time and money. I'm going to click on Dennis Murphy, and I have an indication that green, he's available. So through this tool, I have the ability of chatting and saying, can you call me? I have a question, right? I see that that's going to do a screen pop on Dennis Murphy's desktop, and Dennis Murphy is now responding, and I can see that he's responding. And when he hits enter, I'm going to say, I know he said, I'll call you back in 1 minute. So we took away what would be typically a 3 to 10 minute response, which is email, which gets easily lost, and we pushed this into an easy to use chat session, all built into a user's interface. So we take contacts and we're going to streamline it back into what's called buddies. Buddies and contacts are very similar, except for buddies is a streamlined version of your contacts. Let's say I'm in an office with 200 people, but I only communicate with the top 30. So I can create by simply right-clicking on somebody, I can add them to my buddies list, and now they're up here. Conversely, if I have somebody that I don't want to be a buddy, I can click and remove them, and they won't show up on this list. So this gives me a streamlined view of the people that I might communicate with. There's two sides to contacts. There's your MX directory, which is your internal person, and then there's your external contacts that you may communicate with. I can easily get to my internal people or my external contacts through one click of the mouse. To call them, I simply see Dennis, he's logged in, it's green. I can right click, I can call his desk, call his mobile, or I have other tools over here. I can email him, I am Dennis, and I have other useful tools of communicating with him. This makes communication without an office very simple. I also don't have to remember his mobile phone. I have a historical entry for all my recent calls, and I have a historical entry for all the messages. I have visualization of my voicemail. I can see all my inbound voicemails, and I can see, based on my active role, I can see all of my voicemails by in general, or I can see them by active role, so it separates them. I can see call recordings. You'll notice on this call here, I've been on this call for 28 minutes and 13 seconds. At any point during any call, you have the ability of hitting record. If I was to hit this now, you'll see it goes to record mode, and it actually buffered this call from the beginning, and I'll have a historical record of this call saved in my recordings mailbox. That's very useful for transcriptions. It's very useful for any type of record or any type of call that you want to have a historical entry. Parking calls is really useful for organizations. So instead of having to answer and transfer calls, you have the ability of parking. By parking calls within an office, any user that has this application, whether through their desktop or through their mobile app, can see calls that are on hold. I mentioned the word mobile app because every user can use this platform both from their desktop or, I'm going to click right here, this is a mobile device as well. Meaning, if you opened up this application on your mobile device, you will see your calls on hold. You'll see your buddies. The exact interface you see here is what you'll see on your mobile phone. So users can stay mobile. You have the ability of doing groups. This is a word used in organizations. Some people call it collaboration. Some people call it chat sessions. You might hear of different names in the industry. It's a built-in application within our product that allows users to communicate all through one interface. So for instance, common scenarios, I'm speaking to Aaron. We're chatting, something going on in the office. We're talking about a patient, and I need a doctor to help us. I can drag and drop somebody in this communication, and it now created a chat group. That's where one or more people are now part of a collaborative group session. So it gives a lot of things. One, I can type a message and talk to many people at once, and they can respond. Two, I have the ability of calling everybody simultaneously through the click of a mouse. So imagine in your office, you're having a meeting, you need to get all nurses on a call immediately. You have a nurse chat group, immediately you can go over to here and I can hit call. Simultaneously, every single phone in the organization will go off, and anybody within this group will get a call and be asked to enter the chat group. And that's it. That quickly you can assemble a call. I'm going to hang up on that. You have the ability of faxing. No longer do you need paper faxing. You have IP faxing right to your desktop inbound, and you can send faxing outbound. You also have the ability of doing conferencing calls. Conferencing can work several ways. From the fly, any user has the ability of creating a call. I'm going to just call it doctor's call. You can create once, ongoing, schedule the date, and you have three choices. It can be just a regular call with a phone number, a seminar, which is where I would show you my screen, and or an interactive call where we can all take control of each other's screens. And I can save this. From that easy-to-use tool, I can invite people, both internal to my organization and external to my organization. All these tools are very useful to help productivity within office, allow people to be mobile, and give your staff the ability to interact with patients in an efficient manner. Last thing I'm going to show you here is the status. You may have wondered throughout this presentation why you're seeing green, purple, red. These are automatic statuses. The system recognizes where you're at. So for instance, if you log into your application and you're not on the phone, it's available. If you sign out of, say, of Outlook out of the application, it will put you as not available. If you pick up your phone, it will say you're busy. If your Outlook says you're at lunch, it will disclose that you're at lunch. And lastly, you can click the "You'll be right back." All of these are called presents. So instead of calling people and wondering where they're at, you have the ability of seeing immediately that they're in either a meeting, or here I can see that Dennis is in an iConnect RX webinar. I still have the ability of calling him. I can still call his mobile and calls, but I happen to know where he's at and his status. So it makes communication very easily. So next we're going to move into the call center application. This is very big in healthcare because it allows all of the practice managers the ability to manage call flow. So what I'm showing you right here is a typical interface. So as users become accustomed to logging in and logging out of the queues that we've established, you now as an administrator have the ability of seeing what's going on within your organization. Just a sample board here. And by the way, these are customized in any which way you want to show things. Dennis, are you on a call? Okay, so just make sure. So what I'm going to show you here is how many agents are logged in to the appointments queue, how many people are in queue, what's the longest waited time, how many are answered. This is all a dashboard that typically can stay live both on an administrator's desk, and often it's put in a visible area, high profile area for your office administration so they can see that they're hitting their targets. Queuing is very important. It's the number one reason that patients actually leave organizations and healthcare practices is their inability to communicate, both for prescription refills, scheduling appointments, and follow-up. So if a practice believes that the patient is the lifeline of the organization, then managing that patient experience is a top priority. So these queues, as we start building this out with our clients, we find out what's most important to you. How does your organization run? What types of queues are most important, training your staff on how to log into the queues, and then administratively giving you these tools to manage these calls efficiently. When I say manage these calls, it's actually not you managing it. It's allowing the system to manage the calls for you. We have the ability of adding in color codes. So as an organization, you might say, I don't want to have any more than 4 people in queue. You may say, I don't want to see anybody wait more than 5 minutes in queue. I don't want to see anybody ever get an abandoned call. So I'm going to show you just live. I'm going to put somebody in queue, and you'll see here that it's 1. It's saying in yellow, there's a call in queue. You're going to see the longest wait. You're going to see the wait time now is at 12 seconds. And I've set this up that 12 seconds or 2 people in queue is the maximum I want to see at any given point. What this means is I have 2 people live talking to people, and the system now is managing 2 more people. That tells me as an administrator, I have the ability to push this call to an open person. Longest waited call now is 23 seconds. I've set the threshold, I think we set it to 20. And then you can see while 1 call in queue is acceptable, having a call that exceeds 25 seconds is not. I'm just going to hang up. Those type of tools give an easy to use dashboard so any administrator could easily see the status of what's happening with calls within the organization. All this is great, but then you might say, great, now how do I see how we're doing? And that's where reporting comes into play. Reporting is the final tool that you need. And reporting can be done a number of ways. What we've done from our experience of working with a lot of healthcare practices is pre-build all the reports that you could ever want to use. And with these type of reports, you have several options. One, you can go to the reporting manager and run them ad hoc. You can have them pre-scheduled to run, which is more common. Let's say your responsibility is to run the office efficiently, and on a daily basis, you want to provide leadership with daily statistics, or you want to know. You have the ability of saying at 4 o'clock at every day, I want to know how many calls were abandoned. By doing that, you'll know the number of calls that were abandoned, the time of day they were abandoned, the type of calls they were, and that gives you the ability to staff more efficiently and train your staff, which without this type of data, you would have no way of knowing. Most companies just know that they don't have enough people or that patients are complaining. So it starts with establishing or the ability to establish call queues, enforcing those call queues through that enhanced unified communication platform we showed you when users log in, managing that call flow through the interface that I had just showed you, and then being able to report on it. So I'm going to just run a quick example. We say busy hour report. This is something that's very helpful. So how is our practice doing, and when are we busy? So it asked me for a group, and I'm just going to pick one of the following groups. So let's say I want to see our service group, and I want to see service overflow here. I can run this report, builds the report, and 8/26 through 9/1, I get to see by day of the week how many calls are coming in, how many calls are going out, the total, the average minutes, the maximum minutes, the average minutes, and it's all by hour of the day. This gives me a lot of data that I can make more intelligent decisions. I have graphical user interfaces that can be integrated into any report, and this can all be customized by time of day. If you were a practice manager and you wanted to see, you don't want to look at a monitor, but you want reporting to coming in, you can set this up by the hour. You can set up multiple people. Maybe the doctor or lead practitioner wants to get weekly reports, and those are high-level reporting, and you have practice managers that are looking for daily activity. They can get separate reports. All this is customized. All this is set up by ComTech personnel and gives you the tools to run your practice more efficiently. So this concludes today's presentation. We can go deep dive into any one of these applications. Like I said, there's a lot of people on this call, and I'm sure there's different things that are new to some of you, and some of them are applications and tools that you may have already been using. We can schedule a one-on-one with any organization, and after this call, you'll be sent a quick survey. We'd love to know what you thought of the presentation, and also if you would like a follow-up. That concludes. Thank you very much.